mga ka-learners, it's Dr. Therese. Today, we will learn about the diseases that can affect the lymphatic system. In the previous lesson, you learned about the parts and functions of the lymphatic system. You also discovered the role of your lymphatic system in keeping you healthy by preventing bacteria and other foreign materials from harming your body. The lymphatic system does its work so well that you're able to avoid infectious diseases. In this lesson, you will learn about some diseases that can affect the lymphatic system. Ironic as it may seem, the primary organ system that defends the body from harm is also prone to diseases. Hence, it is important to know what these diseases are. After this lesson, you should be able to identify and describe diseases that can affect the lymphatic system. Let us now learn about what medical experts call the health threat of the century. AIDS is a specific group of diseases that result from the reduction of the immunity of the body. This means that it attacks the lymphatic system, specifically the T lymphocytes or T cells. This is brought on by a virus called human immunodeficiency virus or HIV. HIV is transmitted through the following means: unprotected sex with an infected person, sharing needles or syringes for drug injection with someone who is infected with the virus, or transfusion of infected blood. The three modes of transmission listed are the only means by which one can get infected with HIV. You can't get infected through mosquito and animal bites because the virus lives only in humans. You can't get the virus by hugging an infected person or by sharing their food and personal things, nor can you get it in swimming pools. However, women infected with HIV can pass on the virus to their unborn children. They can also transmit the virus to their babies through breastfeeding. Hence, if a woman is HIV positive, she is discouraged from getting pregnant. If a person is infected with HIV, this does not mean that they will develop AIDS, but they most likely will. Some HIV positive people can go for more than 10 years without developing AIDS. However, once their T cell count becomes lower than 200 cells per cubic milliliter of blood and they develop an infection, they are considered to have AIDS. AIDS causes death because as HIV multiplies inside the body, it attacks and kills the T cells. This slows down the ability of the body to fight infection caused by bacteria, viruses, and other foreign materials. Thus, the patient becomes prone to all sorts of infections, and these infections are the ones that eventually lead to the patient's death. Among these infections are pneumonia, Kaposi sarcoma, which is a type of skin cancer, and meningitis, an infection of the fluids in the brain. Without the T cells to fight the organisms that cause the infection worsens until the patient dies. Here are some more diseases and disorders that affect the lymphatic system. Edema. Mrs. Castro was a 56-year-old teacher. She had been having heart problems for a long time. One day, she noticed that both of her legs were swollen and heavy. She went to the doctor, who told her that she was suffering from heart failure. Her legs swelled because of edema, a symptom of heart failure. She was given medicine to relieve the swelling in her legs and to improve her blood circulation. Edema is a swelling on the body caused by the accumulation of fluid in the body tissues. It results from the inability of the lymphatic system to perform their task of draining the body's fluids. It can also be brought on by various diseases and disorders such as heart failure, kidney malfunction, and varicose veins. Lymphangitis and lymphadenitis. Carlo, a 16-year-old boy, woke up one day to find that his legs were painfully swollen. He remembered that he stepped on a sharp object a week before, but did not do anything about it. Afterwards, he developed a fever which lasted for days. He was brought to a hospital where he was diagnosed to have lymphangitis. Lymphangitis. This is the inflammation of the lymphatic vessels that results from infection by streptococci and staphylococci, two common bacteria. These bacteria are usually transmitted through insect or animal bites. Lymphadenitis, on the other hand, involves inflammation of the lymph nodes. This may occur if the nodes are overwhelmed by bacteria, viruses, fungi, or other organisms. Infection then does develop within the nodes. Both lymphangitis and lymphadenitis should be treated immediately, usually with antibiotics. Otherwise, the infection could spread to the bloodstream and may cause death. Lymphoma. Alice was a 35-year-old housewife. One day, she noticed that there was a lump on the left side of her neck. She dismissed it as a swollen lymph node and hoped it would disappear on its own. However, the node kept on growing. She was constantly tired and losing weight. She consulted a doctor who told her to undergo a biopsy. The result of the biopsy revealed that she had lymphoma. Lymphoma is a cancer of the lymphatic system. The most common type of lymphoma is non-Hodgkin's lymphoma. In this type of disease, cells in the lymphatic system becomes abnormal. They divide and grow without any order or control. This disease can start anywhere in the body. Its most common symptom is a painless swelling of the lymph nodes in the neck, underarm, or groin. Lymphoma patients usually undergo chemotherapy and radiation therapy. Some even have to undergo surgery. Elephantiasis. One is an abaca farmer who often wades in dirty water because of his work. One day, he noticed that his left leg was swollen. The swelling got worse until his entire lower left extremity swelled. He was diagnosed to be suffering from elephantiasis. Elephantiasis is an abnormal enlargement of any part of the body caused by the obstruction of the lymphatic vessels in the affected area. This disease commonly affects the leg and scrotum. In tropical countries like ours, elephantiasis is normally caused by filariasis, an infestation of certain parasitic roundworms called Wuchereria bancrofti. These tiny worms are introduced into the body by many types of mosquitoes. These parasites search out the lymph nodes and lymph vessels where they absorb nutrients. Abaca plantations are often infested with these parasites. Hence, workers are advised to wear boots and protective clothing. Recovery from filariasis is possible, but elephantiasis itself cannot be cured. Let's remember, the lymphatic system is prone to many kinds of diseases. Among these are AIDS, edema, lymphangitis, lymphadenitis, lymphoma, and elephantiasis. AIDS is a group of infection that occurs due to the reduction of the body's immunity. It is caused by HIV, a virus that attacks the lymphatic system, specifically the T cells. Edema is a swelling in the body caused by a buildup of fluid in the body tissues. Lymphangitis is an inflammation of the lymphatic vessels that result from infection by streptococci and staphylococci. Lymphadenitis is an inflammation of the lymph nodes that occurs if the nodes are overwhelmed by bacteria and other organisms. Lymphoma is a cancer of the lymphatic system, the most common type of which is non-Hodgkin's lymphoma. Elephantiasis is an abnormal enlargement of any part of the body caused by the obstruction of the lymphatic vessels. It is usually caused by the infestation of roundworms that are transmitted through mosquito bites. And that marks the end of our lesson on the diseases that can affect the lymphatic system. Next up, we will learn about how to properly care for this system, so stay tuned mga ka-learners.